Allie Manson, ZERO's Vice President of Government Relations and Advocacy, and I'm so excited to have you join us for these final discussions. For our first presentation on sexual health after a prostate cancer diagnosis, I'd like to introduce you to Jen Edgecombe. Jen Edgecombe is the Director of Sexual Health and Wellbeing, Prostate Cancer for Movember. She has worked in the Canadian healthcare system for 15 years with a career focus on oncology and cardiology, and she has personally experienced the challenges in accessing healthcare while living in a rural community and was inspired by this experience to conduct original research to understand the information people need to manage their cancer care side effects and how that changes based on if they're in a rural or urban center. With that, I'll turn things over to Jen.
So thank you for this opportunity and thank you for the introduction. Again, my name is Jen Edgecombe. I'm here from the Movember Foundation, and I'm here to talk about sexual health. Today, we are going to talk about prostate cancer and sexual health. I'm going to be using a little bit of language that helps me to describe different parts of the sexual experience. My goal is not to make anybody uncomfortable, but just to use the language so that we all know what we're talking about. When you begin to have these conversations, I want you to find the language that works best for you. Because the goal of today's conversation is to share some of the tools that have been developed to help you talk to or talk about your prostate cancer and sexual health and intimacy. And that might be to your doctor, that might be to your partner, or it could be to a future partner or your support team or your support network. So let's get into it. I think it's important first to talk about who is Movember. So Movember is actually the leading charity. We are the leading charity, and we're changing the face of men's health around the world. We've done some cool things. Since 2003, Movember has built a global men's health movement. We've funded more than 1,300 projects around the world. We're challenging the status quo, we're shaking up men's health research, and we're transforming the way health services reach and support men. So we do this in three main areas, and those are prostate cancer, testicular cancer, and men's health and suicide. And as we say, let's do something that means something. I'm going to say something that really is an unfortunate truth. All prostate cancer treatments have side effects that impact sexual function. The reason I need to say this today is that I want to normalize it. You're not alone. If you are somebody who's experiencing changes to your ability to have sex because of your prostate cancer treatment, you're not alone. Every man who's undergone this treatment, it has been in this situation. And if you're thinking about or you're starting your prostate cancer journey, not to worry, we're going to talk about some of the options. I'm sure your doctor or care team have talked to you a little bit about the side effects from prostate cancer treatment. You know, sometimes we get given this big list and we don't always look all the way through it. But I think that a lot of the items on this list, if you look a little closer, are actually to do with your ability to have an erection, maintain an erection, ejaculate, and even achieve orgasm. So let's talk about sexual function. As I said, all treatments for prostate cancer have sexual function side effects, and those really do affect quality of life, especially if you're somebody who's used to having a lot of sexual function heading into your prostate cancer treatment. Changes to your sexual function or reductions to your sexual function are called sexual dysfunction. And it's the most commonly reported health-related quality of life outcome after prostate cancer treatment. So that means that this is what people have told us is the biggest problem that they face after they have prostate cancer treatment. It doesn't just affect the person with the prostate, it affects their partners and the relationship. There are some things that might change the way you experience this, and that's, where you live, what your ethnicity is, what your race is. Those can affect your perspective. So kind of how we talk about sex, how we experience sex. Some of the pieces are around gender roles. So what does being a man mean? What does being a woman mean? Your sexual orientation, your relationships, the relationships that you have now and maybe future relationships, health benefits. Disparities just mean differences in your ability to access healthcare. Do you live in a center where there's a big hospital and there's lots of services? Or maybe do you live far away, or other reasons why you might not have the same access to healthcare? And the ability to actually go and take those services. So when we look at some of the research that's been done, prostate cancer survivors continue to report unmet needs up to 15 years after they've been diagnosed. That's a long time, 15 years. So here's the challenge. There's a lot of research that's showing that the problem and the need in most regions and services are still failing to routinely and systematically support sexual health needs of men with prostate cancer. So what does this mean? This means that our healthcare system isn't helping with those changes to sexual health and function. At Movember, we've decided to do something about it. So we're taking some action. I'm going to talk a lot about that now and what that means for you and how you can find out more about what we're doing. So this might not seem like much to some people, but Movember has actually funded sexual health guidelines. So when we look at healthcare, all healthcare treatments, tests are all because of guidelines. It's a guideline is a level of evidence that research and healthcare uses to make decisions. And we now have 47 recommended statements about sexual health care in prostate cancer. That means 47 different specific ways that we want to see sexual health and prostate cancer addressed by your healthcare team and for you as the patient. We're going to use this term biopsychosocial a few different times. What it means is your body, your mental state, and your social construct. And we're going to dig into that in a minute, but I'm going to talk about it here. So the 47 recommended statements are broken up into pre-treatment education. So that's for you, the prostate cancer patient, and assessment. So asking questions about where you're at with your sexual health, and then beginning to give you some information to help you make decisions. After your treatment, we want to see a biopsychosocial assessment. And after treatment, we want to see biopsychosocial management. So we want somebody to find out where you're at and then give you some opportunities to do some things about it. So we have 47 statements, like I just said, and the statement 1, I think, is the most important statement. A clinician-initiated discussion should be conducted with the patient and the partner, if the person has a partner, and if it's culturally appropriate to do so, about realistic expectations of the impact of prostate cancer therapy on the patient's sexual function, the partner's sexual experience or the future partner's sexual experience, and the changes to the couple's sexual relationship. So we're going to talk a lot more about what this means, but this just means that you as the patient should expect that your doctor or somebody in your care team is going to talk to you about this. So we mentioned biopsychosocial, and those are 3, that's a big word. So we're going to break it down a little bit. So biologic is just what's happening in the body. We've got the hormones, we've got changes in the way the body is changes in the body. That can include scarring when we've had treatment or radiation therapy, loss of a body part, loss maybe of your prostate, changes or lack of sensation. You may experience pain or fatigue. Psychological is your emotions, so your mental state, so depression, anxiety, your body image, and also motivations for sexual function or sexual interactions in intimacy. The other piece is that cultural or social beliefs. So, depending on your religion, what's normal in your culture and what's normal socially for you. And then interpersonal is the relationship between you and your family, your fear of intimacy, and maybe lack or strength of communication. And cancer-related sexual problems impact all of these squares, and we call it the biopsychosocial model. I'm going to show a video that I think really helps to describe why we're doing this work. It's a video that some of our patients around the world have helped us to make.
Had some of the most intimate and sexually fulfilling times we've ever had since my prostatectomy. I didn't think that was possible, but it was.
To be honest with you, I could not have gotten through this without her. It affected our sexual activity, but living was more important than that.
I completely shut my wife out of the process. Completely. I didn't allow her to fulfill the role that I know that she wanted to, and that I know the great job, that she would. But I didn't allow it.
I woke up one morning, opened my eyes, and I'm like, he's back. I called John. I'm like, oh my God, dude.
I have an incredibly loving and understanding wife, and she's put up with me for almost 35 years. I didn't seek out any other support group except for her because, she's truly my support.
My mistake for shutting my wife out? No, man. Include your wife.
When I was able to have a normal sexual life with my wife, it was really important to me. And it sounds funny. I think she even said one time, "Good job." She can validate that later.
Well, the reason I wanted to show that video is I wanted to really kind of highlight the reason why Movember began to do this work. There's no shortage of these stories of people with or without partners experiencing sexual dysfunction, and then what it kind of does to that person in the way they feel about themselves, in their relationship. And so it's a really important to, one, show why we decided to do this work, because after all these years, it doesn't seem like anybody else is. And so Movember decided that this is our space to do something about. We really think that we can make a difference for people and their partners when it comes to sexual health and well-being. So I've talked a lot in this presentation about the guidelines. I've talked a lot about the resources that are available to you. The video that I just showed, and some of the other videos that are available are all on this website. I know that some people learn through videos, and that's great. We have a ton of them. So visit the website. The picture with the dinosaur is a QR code. So if you want to take your phone right now and open it up to the camera and hold it over the QR code, same as you do in a restaurant when you want to look at the menu online, it's going to take you right to our Sex After Prostate Cancer webpage. This website is where you can find everything that I've talked about so far. So I'm just going to give everybody a minute if you have to go and grab your phone, or if you have any questions about it, just get somebody else to give you a hand. And if all else fails, just write down the URL that's at the bottom. And that way you can access everything that I've been talking about. Okay. So here's how Movember is doing this work. One is we've created sexual health and well-being resources, and we're creating more. So this is just the beginning. So far, we have the website that I showed that URL and that QR code for, called Sex and Intimacy After Prostate Cancer. We have lots of information available, and we have tools for you, the patient, to help you to ask the questions that you need to ask, and also to really understand what means most to you. We funded the development of the guidelines, and we're really working on helping those guidelines to be used around the world. Just because guidelines are produced doesn't mean that they're going to be used. So we've created partnerships with the International Society of Sexual Medicine, and we are working to help healthcare providers, so your care team, your doctor, your nurse, your social workers, to have access to those guidelines. We have worked with a number of different organizations to create training for healthcare professionals. Just because we say, and the experts say, that someone should talk to you about your sexual health and well-being before you get prostate cancer treatment, doesn't necessarily mean that our doctors and nurse and care team know how to do this. Just like how you might not be comfortable because of a variety of reasons, your care team is made up of humans. Like, they might feel the same as you. And so Movember is working with organizations to create online training. We called it Share T. And we are working on helping professionals in 7 different countries to access those courses. This is really interesting. So in the 7 different countries, we're working with the healthcare organizations and the healthcare system to build plans that are specific to those countries to help those guidelines meet the needs of each country. So the United States has much different needs than, let's say, England. And so we're really working with the leading healthcare providers and organizations in each of those countries to come up with plans to figure out how to best implement these guidelines. And then I think this sounds fun. So biomedical treatment research, but really what that is we're bringing together all of the experts. And if you remember biomedical, that's physically what's happening. So we're bringing in the experts from around the world to find out what else can be done. Is there more that we can do to really change sexual dysfunction or resolve sexual dysfunction that is caused by prostate cancer therapy? And we are publishing the report and recommendations from there. So the goal of all of the work that we're doing right now is to give men like you the information you need to have discussions with your doctor, with your partner, with your family, with your future partners about prostate cancer, sexual health, and intimacy. So here's what you can do. This is your role now. Visit the website that I showed at the beginning I'm in that earlier slide, and help to identify for yourself, what information do you need? Give some thought to your sexual health and intimacy, and what did that look like for you before treatment? So really think about that. And if you've already started treatment, start to think about your sexual health and intimacy now, as soon as you can. If you have a partner, begin to have the conversation about sexual health and intimacy, especially if there's been a change in your sexual health. Let's get it out there. Let's talk about it. And have the conversation with your doctor. If your doctor or care team haven't initiated the conversation, don't wait. You initiate the conversation. Thank you so much for listening to my presentation. So my first question that I've received here is, does my sexual function return after the removal of my prostate gland? So I'm going to read to you directly from the website. Surgery to remove your prostate affects the nerves and blood supply around your penis. Your penis needs a healthy blood flow to get an erection. Without this, your penis will not become as hard as it did before surgery. Sometimes the bundles of nerves on both sides of the prostate must come out, so we can't spare the nerves, and the damaged nerves can sometimes recover. However, cut nerves can't regrow. So people who have this type of surgery will not be able to have erections firm enough to have penetration without an erectile aid, such as medications or devices. So you can read this for yourself under erectile dysfunction on the website that you are connecting to with that QR code now. Okay, my next question. Is penile rehabilitation required to prevent shrinkage? That's a great question. Again, we're going to go to the website and I'm going to direct you to the page Learn Erectile Dysfunction Penile Rehabilitation. And I'm going to read from that now. So penile rehabilitation, also called erectile rehabilitation, simply means using machines or devices to improve your erection after prostate cancer treatment. The goal of penile rehabilitation is to help you regain your ability to achieve natural or spontaneous erections, achieve erections using erectile dysfunction pills or penile injections, achieve erections during using pro-erectile devices such as a penis pump. You can think of penile rehabilitation like physical therapy or exercise. It's similar to doing guided exercise after a knee replacement or shoulder surgery. So again, that can be found in Sex After Prostate Cancer, Learn, Erectile Dysfunction, Penile Rehabilitation. Let's go to our next question. Treatments for erectile dysfunction and the length of time men should wait before exploring penile implants, etc. Oh, okay, so I think this is asking, what are the treatments and how long do you have to wait before starting to use the treatments? So again, we're going to go to that Sex After Prostate Cancer and then Learn erectile dysfunction and then medication devices. So from that web page, it says choosing a treatment for erectile dysfunction after prostate cancer can be intimidating. There's a lot of options, so it really is. Not to worry, there's no one-size-fits-all approach. What's best for you may depend on your prostate cancer treatment, other medical problems. So if you have something else going on, if you have heart disease or diabetes, let's say, or whether you had erectile problems before treatment. Depending on your goals for recovery, you might choose a less invasive approach, for example, some medication, or a more invasive approach, for example, penile injections. And whatever you choose, you just talk about it with your doctor. So the goal again is to have you visit this website, learn a little bit, and then talk about it more with your doctor. Then you can go back to this website to kind of maybe look a little bit more at what your doctor was recommending. Okay, and our last question here is, what are the options for regaining ability to achieve erection after prostate cancer surgery? Yeah, so again, same website, go to Learn, go to erectile dysfunction, medication devices, so same one we were just on. And there it says, choosing a treatment for erectile dysfunction after prostate cancer can be intimidating. but not to worry. There's no one size fits all approach. What's best for you may depend on your prostate cancer treatment. So this is why it's really important for you to talk to your doctor and your care team, because they know what treatment options are available to you. And again, same as above, might be dependent on other health concerns you might have. And so I think that, again, learn a little bit about what the options are, begin to think about what options might work for you and your partner or your future partners, and what might not. And then you can help to kind of make those decisions about which treatments you are interested in exploring. So thank you so much for this opportunity to present today. Again, my name is Jen Edgecombe. I'm from the Movember Foundation, and please visit our website, and best of luck.